Hi, I'm Dr. Marian Barrand-Wishaw. I'm a certified master hypnotherapist, a religious science practitioner emeritus, and I have my PhD in clinical hypnotherapy. What I would like to do today is teach you a biofeedback technique to help you reduce some chronic symptoms that you might have. Chronic symptoms I'm talking about are sometimes there's chronic anger or anxiety, cravings, pain. On the other hand, we can also increase our energy, our immune system, our joy, our happiness, our metabolism, and we can increase our self-esteem. But first, I would like to speak with you about the way we speak about things. Oftentimes, when someone has pain or anxiety, they say, "Oh, my anxiety is so high today," or "My pain is really bad." Do you hear the difference if I were to say, "The anxiety is high today," or "The pain is really bad"? When we say "my," we own it. Now, do you really want to own the anxiety or the bad pain? I don't think so. However, when you speak of the anxiety or the pain, now it's removed. You might say it's semantics. However, we don't really want to lose things. So when we speak of something as my anxiety or my pain, we're owning it. It's a part of us, a part that you don't really want. However, when you own it and it becomes you, you really don't want to lose it. So by switching your verbiage to the pain, the anxiety, it takes it one step away from you. So now, let's look at the biofeedback technique that I was speaking of. Well, what we start out with is, we'll take a sheet of paper, and as you can see, I placed an arch on this paper. And at the bottom, right corner, I put a 0. And at the bottom left, I put a 10. Just like a pain chart, from 0, no pain, to 10, the most pain. And in the top of the arch, in the center, is the 5, right smack in the middle. So then between the 0 and the 5, I divided up the numbers between 1 through 4. And between 5 and 10, I divided up the numbers between 6 through 9. So they are evenly spaced. And then this sheet you place on a table in front of you. You can also go to my website and download this very same sheet that you can use for yourself. My website is www.marianwishall.com, marianwishall.com. Next, you use a pendulum. You don't need to use a fancy pendulum. I have my little quartz crystal pendulum. What you can also do is take a piece of thread and a ring, and there, now you have a pendulum. Well, let's get on with the demonstration. So here I have my paper, I have my pendulum, and I'm going to rest my elbow on the table and let the pendulum hang between the 0 and the 10 in a straight line and exactly opposite the 5. And I will first ask the pendulum, what level is my anxiety at right now? No anxiety to 10 the most. Where is my anxiety at right now? It's swinging to an 8. So let's bring it down to a 7. Down to a 6. Down to 5. 4. Wow, it's doing it by itself. I'm not even asking it. It continues to go down. And there it is at around 0.5. It's not down to 0. It's about 0.5. That feels much better than the anxiety of 8 that I was feeling earlier. You can do the very same thing with pain. And with pain, you might notice a difference as you go through the process. Now, you may not get down as far as a 1 or a 2, or even a 0. But I'm sure that a pain level of a 2, 3, or 4 is much better than 8, 9, or 10. And by practicing this and doing it many times throughout the day, you can practice keeping the pain level at a lower level. So let's say you started at a 9 and you were able to bring it down to a 4. That's very good. And then let's say in a couple of hours you notice it starting to creep up. Well, get out your paper and your pendulum. As you see, it doesn't take very long. And start again. What number? Always ask the question, what number is the pain at right now? Don't assume it's at a 9 or a 10. You ask. And you might be surprised. It may not even be up that high. So this time it might be at an 8. And then walk it down, bring it to a 7, 6, 5, 4. Maybe you can even get it down to a 3. You take it as far as you can, and you let the pendulum swing there for a little bit. Then sit back and feel the difference inside your body. You've done it. You were able to bring the pain level down. The more you practice this, the easier it becomes. And you might even notice that you can do this in your head without actually having the pendulum and a piece of paper. You can actually say in your head, what number is the pain at now? And maybe you can visualize the pendulum swinging to that number of an 8 perhaps. And then say to yourself, bring it down to a 7, bring it down to a 6, bring it down to 5, bring it down to 4, bring it down to 3. And even if you cannot visualize that pendulum, you will find you'll be able to talk yourself down to that lower level. This is a very handy tool. And it really works if you work it. You can use it on a regular basis, anytime. Another thing you can do with this technique is to increase energy, immunity, joy and happiness, metabolism, and self-esteem. When we want to lose weight, that's when we need to increase our metabolism many times, or increase our energy. So with that process, it's the same thing. Once again, we hold the pendulum between the 0 and the 10, opposite the 5, and we ask the question, what number is my metabolism at right now? Well, it's swinging to a 4. So that's pretty slow. Let's bring it up to a 5. Let's bring it up to a 6. Bring it up to a 7. Bring it up to an 8. Very good. I'm going to leave it at an 8. I don't want to bring it to the extreme of 10. The reason why I said not to go to the 0 or the 10 with regards to your metabolism is because extremes are never good. And first of all, I would like to suggest that you check with your physician before even using this process and working with your metabolism. It is very important that your physician approve of this process of you changing the rate of your metabolism. You also don't want to bring it up to a 10 when you do work with it because it is way too high. An 8 would be plenty. If you were to have brought up your metabolism after dinner, and when you go to bed you find you can't sleep, you may need to bring your metabolism back down to perhaps a 3 or a 2, but not less, because your body continues to function and your metabolism needs to continue to function for your health. However, if you're working with this pendulum regarding pain or anxiety, I totally understand. You do want to get it down to a 0, and that's fine. I wish you all well in working with this. Not only is it helpful, it's also fun. Remember, change your thinking, change your world, and change our world.